everyone to the Health, Hospitals, and Social Services Committee on Juneteenth, which is June 19, 2018. And we are going to begin our meeting quickly. We have a couple of things that are here, and one of the sponsors actually has a letter, Steve Glover, before us. But the first thing that is before us here today is RS 2018-1248, sponsors Bircher, Gilmore, and Withers, a resolution adopting a new pay plan for employees of the Metropolitan Board of Health, effective January 1, 2018. July 18th, 2018.
Motion.
Motion? Second, all right. Any discussions?
The board adopted that in, let's say, April. Maybe it might have been May, but in effect, it will mirror whatever Metro's ultimate pay plan looks like. Because the Board of Health is our civil service board, so whatever comes through when you guys get done, it will mirror whatever that says.
All right. Good stuff. Any other discussions? All right. I'd like to close that. You have a pen? Thank you. I thought I had it. All right. So, any? Here we go. Thank you. All right. Those are for this, please. Raise your hand. Let me say 1, 2, 3, 4, 5. 5 for, 0 against. Thank you very, very much. And it goes for approval, right? And we will do that. Chair Erica will be here. She is just running behind. She actually had to work today, like we all do. All right. The next is sponsors Pulley. My brother here, 2018-1261, sponsors Pulley again. This resolution approving the affiliation agreement between the Metropolitan Government of Nashville and Davidson County, acting by and through the Metro Social Services Department, Homeless Commission, and Lipscomb University to provide an opportunity for students enrolled in Lipscomb University Department of Social Services and Sociology to experience training, instructions, and education in the discipline. All right.
Motion.
All right. Okay. Is there someone here to speak on that?
I'm happy to speak to it, or Ms. Tackett can, either one. Mm-hmm. It's entirely up to you if you'd like to.
Just quickly, it's to establish an internship program in relationship with Lipscomb University's social work program and leverage what we do with the outreach team that we have.
Okay. All right. Any questions?
Yeah. Do you have other internships from other universities
No,
as well?
that would be the first one.
Did they reach out to you to do this?
No, we reached out to them, and we did reach out to others too, but we want to just see how it works first. Mm-hmm.
And this is for our annual internships where they would actually be putting in roughly 500 hours during that period.
Great.
Mm-hmm. Yeah, I was just wondering about Metro Action, considering that they also provide similar services if they were considered. I think it's a great opportunity for people to get a better understanding of how things work in Metro, and with the challenges that you and the uniqueness that you've had to create in order to do the things that you all have done at the Homelessness Commission. So just wondering if there were greater opportunities for students.
That could be. I think that's a great idea. Our idea is to test it out, see how it works, and how we can benefit mutually.
All right.
Yeah, my daughter was in that program, so. Well, she's graduated now, thank the Lord.
Oh, wow.
Yes.
No more money coming out of your pocket. All right.
No, that still happened.
Oh, wow.
Yeah. Don't go there, man.
Yeah, we'll leave that alone. All right. Now let's take the vote. For those for this, please raise your hand. All right. 5 for, 0 against. Thank you very, very much, and this will go for approval. All right. And thank you. All right, Resolution 2018-1199, sponsors O'Connell, Gilmore, and others. This ordinance amending Section 2.144.020 the Metropolitan Code, dissolving the Metropolitan Homeless Commission, repealing ordinance number BL 2005-82, ordinance number BL 2011-917, the ordinance number, BL 2014-777, and creating the Nashville Davidson County Coalition of Care of Homeless Planning Council to serve the governance board for the Nashville Davidson County care. All right. Is there any motion? Okay. Second. All right. And yes, there you go.
If I could indulge the chair and allow me to extend the opportunity for constituent to speak on this.
Yes, sir.
Go ahead, Steve.
Okay, thank you so much. My name is Steve Ryder, and I oppose this bill. I believe that it's not compliant with federal regulations, specifically the HEART Act. And so I've cited here 24 CFR Part 578 on the continuum of care program. And basically it gives the continuum of care the right to go out and to amend their own charter. This ordinance would go out and strip that right from the COC. It would basically go out there and say that if the charter is going to be amended and this governance, that it'd have to come to council if we're going to go out and change the membership or go out and on voting privileges. The combination that they brought together was the Homelessness Commission, which consists of 22 members and 15 voting, 7 non-voting, and the current COC board, the governing board, which is 15. If you take the voting members of all of them, that's 30. This legislation proposes 25. It just doesn't make sense to me. I mean, this whole thing. So let me just go on my comment regarding the charter that would take the ability of the COC away. It is my position that is the exclusive jurisdiction of the continuum of care to review and modify their charter. The proposed legislation strips that power from the COC. The proposed ordinance is before the Metro Council is unprecedented. I believe it is problematic to have significant governance issues such as the composition of the new group and its voting privileges included in the Metro Code of Laws. Furthermore, I state, I have not been able to find another continuum of care, not one, which has its governance charter terms put in ordinance form. And I believe the simple reason for that is it is not compliant with federal regulations. So even in the charter that we passed to go out and amend it says we can go out and amend our own charter with a special meeting or a regular meeting. But if you pass this, you take that right away. It's an even violation of our charter. The other thing is that what it's called is this planning council. 24 CFR Part 578.5 says the continuum of care must establish a board. That's what it says, a board. It doesn't say a council, it says a board. We're not even compliant with that. So it's really problematic. The other thing is regarding the legislation, it's going to basically it says the Metro Homeless Impact Division of Metropolitan Social Services shall provide staff and resources to assist the Nashville Continuum of Care Homelessness Planning Council in carrying out the duties and responsibilities established by this chapter. I just want to point out that it is the COC collaborative applicant who receives federal planning money that is used to staff the COC. The collaborative applicant, that's their job, is to staff those committees. You are doing something and saying, oh, okay, You pass this ordinance, and then this Homeless Impact Division is going to take some role in that. Well, it's really confusing because the custodian of records is really the collaborative applicant. That's where you go. So you're raising all sorts of confusion as far as how this structure is going to work, and frankly, it's not in compliance with federal law. So I'll let it go at that at this point in time. If there's any questions, let me just summarize and say I respectfully ask that you defer this, because if you pass this here today and it passes on second reading, it's not amendable, and you're going to leave me no choice but to go out and file a complaint with the federal government. And I don't want to do that because that's going to hurt our rating and the amount of money that's going to come here. But I'm prepared to do that because I think this is going to hurt the future of our continuum of care. Thank you so much.
Oh, you're the chair.
Yeah.
If I may, my name is Quan Poole. I'm here on behalf of Metro Legal. We worked extensively on creating this ordinance. There was conversation through Cloudburst, through HUD. They have reviewed the ordinance. They have compared the ordinance with the HEART Act, and there was nothing in there based upon their review that would put the new planning council at odds with the HEART Act.
Do you have a letter stating that?
I do not.
Because they haven't, because I've talked to them myself. They've issued nothing.
And I also want to point the committee specifically to subsection D, which gives independent authority. What it says is the planning council shall serve as an independent body and shall be empowered to make the decisions and recommendations as a governance board of the Nashville-Davidson County Continuum of Care as required by 24 CFR Part 578, which is the HEART Act. So built into the ordinance is a specific clause that empowers the body and allows them to make whatever recommendations or whatever decisions they need to stay in compliance with the HEART Act. And based upon the conversation that we had with HUD and based upon that specific provision in the ordinance, which empowers the body, we do not feel there were any legality issues with the ordinance.
If I just may, I've talked with HUD too. They have not rendered any opinion. And to say that they have looked at something and they've rendered opinion, said there's no problem, is factually incorrect. And I would just ask from you who you talked to, where you got that, because you don't have any written documentation to that effect.
Well, let's go.
Because there isn't any.
Any discussion from us?
But I'd like to know why does it need to change in the first place? What was the purpose of the change?
So I have been here talking a lot. We have the chair of the Homelessness Commission here, if you want to, if I could refer to her.
So if you think back to 2005, when the first plan to end chronic homelessness was created, part of that was the recommendation for a homelessness commission, which was put into place with very little authority. About 4 years later, the continuum of care, which is a model about bringing the community together to really look at how they address issues, originally, and I don't have as an extensive experience with that, is that it was around distributing the HUD funds that came into the city. So prior to me coming on as chair in December of 2015, there had been a consultant brought in to really look at how are we doing as a city regarding serving homelessness and helping to end homelessness. And their recommendations were we needed to connect our services better. I'd almost call it consolidation, but I'm not sure that's the correct word, because we had outdated two systems operating. They were bifurcated and they weren't connected. Through that conversation, MDHA was able to bring in another set of consultants from Cloudburst who started gathering the community about 18 months ago around looking at what did we really need as a city. And through those conversations with both representatives from the Homelessness Commission, representatives from the COC, and other people within the community, the conversation was really we need one governing body. And if we could create one governing body, we would be able to bring in future dollars to the city around homelessness. We would be able to connect the services that are provided in a more robust way, and you could bring the players you need at the table to really have the conversations you need to have. And so really through those conversations with Cloudburst, as we sat in design meetings, it was like, why don't we have one system? So A year ago, on behalf of the commission, I went to the continuum of care and asked if they wanted to date, is how I framed it. Do we want to sit together and look at how might we work best together? Is there a way for that to happen? And so over the last 12 months, a work group was formed, which included the executive committee of the commission and the governance board of the continuum of care. And we've been meeting twice a month since that time and really looking at what were possible models, what could it look like, continuing to get information from our technical assistance providers. Because our belief is, Sharon, if we can connect all this, we're going to be stronger as a city. The belief was we needed to have both the public, we needed to have the government's commitment as well as the private sector's commitment in this, which is why we wanted a blended body of both appointed and elected members, because we'd be stronger. The city needs to make that continued commitment to working on this issue. We found there was a mechanism called the Planning Council that would allow us to do that, that could have, if you want to think about it, as a hybrid of both elected members and appointed members. We wanted to make sure that we had good representation from people who either have had lived experience or are currently experiencing homelessness. So as you look at the different categories, or slots almost, if you would describe it, that's what we were looking for.
So could this not have been accomplished with simple memorandum of understanding or some kind of agreement with those organizations, community organizations?
So HUD really basically, through their technical assistance, said to us, you need to get this, these are Liz's words, better organized, cleaned up. Because what we lack in the city is truly a solid coordinated entry system. We really lack great data management. And by having two systems, even with a memorandum of understanding, so a solid collaboration, we were never going to get there. So I'm telling you, there's a lot of people that have put in a lot of time before it's come to this committee to really think this through about why do it, what's the benefit, what could it look like.
And what kind of participation from the homeless community did you have on the committee or the council or the body that was reviewing?
So a couple ways that we were to get input. One was we have people who have experienced homelessness on our commission, and so they were involved as well. Wendell Seagroves, who's sitting behind me, is a commissioner that served. And every issue came back to the commission. From the COC, lived experience on the governance board?
Yes.
And then during the process when Cloudburst came in to really look at what we needed, they did community meetings and over 130 people participated.
I think so.
Is that my number? I'm not sure. But that's where, this was never to be an excluded process. This was to be a process that built on all that work that had come before the work group was formed.
Thank you.
All right. Any other discussion?
You want to weigh in on this?
Well, I don't think they've really addressed the fundamental issue, and that is you're creating governance by putting it in a Metro Code of Laws, which the COC is not going to be able to modify on a regular basis their own charter, which federal law says the COC has that right to do that, to amend their own charter. There's no other COC, none, zero, that puts their governance issue in an ordinance. There isn't one. And with all due respect to Metro Legal, I've talked with HUD. They have not rendered an opinion on this at all. They prefer not to.
Maybe they did
Because they have to wait. It's like, okay, you go and pass it, then I can file my complaint, and then they will address that issue.
So were you a part of any of these 100 meetings that they had?
I've attended, and frankly, they made up their mind to just go out and do it their way. They weren't listening to anybody. That Tim Leith on the commission, he tried to go out and make some comments regarding that. I don't think Tim was really even listened to.
I would have to disagree.
Okay, well,
So what do you think?
we can agree to disagree on that. Liz, I'm sorry.
understand.
It's not unanimous. It's not a unanimous sort of thing.
Steve, what do you think a compromising position could have been as it relates to this?
You can't. There is no compromise. It's not in compliance with federal law. You simply cannot go out and by ordinance, put in governance governance issues, composition, and voting privileges in ordinance, because then the COC doesn't have the right to do that anymore. Only the council can change that, because it's in the Metro Code of Laws. That is something that's not permissible under federal law. It says, if you look at the document that I had given you, it basically cites that you will go out and review and update the charter.
And so with
So
that-
we can't do that.
Yeah, we can go around it.
Yeah,
We cannot, the COC doesn't have the right to do that because we're not the Metro Council. So we can't do that. We don't have that right. That right is being stripped away from the COC membership, the general membership.
All right.
And that to me is a dangerous precedent.
All right, Steve, but go ahead.
One final point.
Yeah.
So what Mr. Ryder has cited here are federal regulations, and that's his interpretation of those regulations. No attorney, no legal representative of HUD, no legal representative of the federal government has interpreted those regulations to mean what he purports them to mean. We have reviewed this document. We have no concerns about the legality of them, and we would stand by our interpretations. And then finally, there's nothing in this ordinance that prevents the new planning council from updating their charter on an annual basis.
They cannot because only the council can do that.
Yeah.
And you don't have a letter supporting
All right.
what you just said.
Yeah, Steve, we'll just bring it back to us here. Are there any comments by you, council?
Just one, I appreciate the passion behind this issue. We as a council, though, we're left with advice from our legal department, and it's clearly stated to us that everything in this meets the law, and I appreciate what you're saying, Steve, but our guy's sitting here telling us from Metro Legal everything's good, so I'm prepared to support it based on that.
All right. There any other?
Yeah, similarly, beyond the legal interpretation, I think that amazing due diligence has been done on behalf of the organizations, and I support it as well.
Is there any other discussion? All right, we'll go ahead and move on those four. All right, 5 for it, none against. That is approved. All right, we have one more. That is Bill 2018-1201, which is an ordinance amending the Charter 812 in Metro Code of Laws regarding animal control regulations. Councilman Schulman, this is you.
Make a motion.
Got a motion? Yeah, thank you.
So, thank you. Every year about this time we start getting those emails from people who and their concerns about their animals being left out. And we started getting some. So talked to Mr. Jameson, tried to figure out what we could do. This is a measure that I think takes the temperature down about when you have to provide better shelter and food and water. But to be honest, we've been so tied up with the budget that we haven't had a chance to look at it.
Yeah.
This usually will generate some conversations. I know that some people have talked to me about amending it, so with the diligence of the committee, what I'd like to do is just defer it one meeting and then work on it, make sure we've got it right, and then bring the proper amendment, and then we can move. And then see if anybody has any issues, but we always get this, and somebody finds an animal that's out there.
Yep.
And I haven't had a chance to talk to Mr. Sharp, and obviously he seems to have a question.
I have an issue.
Okay.
Just as you're debating this going forward, in the month of June, from the 1st through the 17th, there were 8,850 calls to MAC to complain about something. That's 520 a day. On your busiest day, you don't get 520 calls. Nobody does.
Short-term rental, I don't know.
We're killing these people. Seriously. And every time we fiddle with this, it sounds good down here. We can just lower the temperature just a little bit. These calls go up again. We can do these things, but it's going to cost money. You're going to have to give these people some help.
I'll move to defer one meeting.
Second. All right.
Yeah,
All right, I guess I'm
I'm sure the fiscal.
So we're going to defer this to one meeting, and we'll move on from there. That is it for us, and thank you guys very much, and look forward to next meeting. Thank you.